Whiplash is a condition that commonly affects the neck, but the similar processes go through the lower back as well. Now, it's typically you're in a car accident or a fall, and what's happened is the neck has rapidly gone forwards and then backwards. And this creates a lot of damage and injury, particularly to the ligaments in this section of the neck. And this can often lead to you going to the A&E and they do x-rays or scans to have a look to see if there's anything broken. But frequently, and the patients that end up coming to us have had the accident often quite a while ago, and they've been, oh, you're fine, you're fine, you're fine. But actually they haven't really looked at the degree of ligament damage and soft tissue damage that's taken place in this region, and it's not healing effectively. And this commonly is because some of the practices after we've injured our neck is to hang the neck like that and really lean forwards. And if we've just ripped all of these structures on the back here as we've gone forwards, but we persist in hanging our neck forwards like so, it means that when those ligaments start to heal up and repair, they're a lot looser than they otherwise should be. And this then leads to less stability in the neck in the long term. Because the neck has lost its natural curve, it's constantly putting more pressure through the discs. There is often going to be a degree of disc irritation when we go forwards like that very quickly in a car accident, for example. And we have a real soft tissue injury around here, in spite of there being nothing broken in the bones per se. And this is why these sorts of problems, whiplash in particular, can be very difficult to really get the effective relief from, because typically you're sent for physiotherapy or physical exercises, which involve moving the neck around even more. And if we've got a lot of damaged tissue, it's not always best in the early stages to actually get that moving excessively. Little bits of movement is good. Small undulations and little movements here and here are okay, but excessive end of range movements, even done slowly, can stress tissues that are trying to heal. The easiest way for you to think about this, if you've got a little scab on your knuckle here, if you move your finger like that, it's not going to rip the scab. But if you're doing that all day, the scab's going to take a lot longer to heal than it would if you just left it and maybe done a few smaller movements. So it's worth bearing that in mind. Now, when it comes to whiplash, we always want to look at the neck in detail to understand exactly what the alignment is, how that neck is positioned, what factors have stopped it from healing. Because, as I mentioned earlier, we very rarely see whiplash patients at the time of the whiplash. Is often a couple of months and sometimes, unfortunately, years after the injury, where it's just been persisting and persisting and persisting. So we want to understand what effect has that had on the alignment of the spine. Is it normal still and they're just unlucky, which is often or very infrequently the case? Or is there some misalignment there, which is very frequently what's happening? And that is what we really need to address. Now, this might be the opportune moment to mention our spinal remodeling video, and that's on our YouTube channel. You should definitely check that out if you think this applies to you, because that's very, very important in dealing with whiplash cases. But when it comes to the treatment itself, we have a compressive pathology, something that's caused excessive compression and injury to the soft tissues. So we start off with doing our IDD therapy or spinal decompression, and that unloads those tissues, takes pressure off, gives the neck a breather. Then we've also got our laser therapy, and that reduces the inflammation and gets things to start healing more effectively in this region of the neck. And that's very, very important. Those two are very, very easy treatments to have done, very relaxing for the patient, and they're essential to getting those tissues to start healing in our experience. We also have muscle spasm. Quite often the muscle spasm around this region is quite perverse. There's way too much of it. It's contracting, pulling the neck in all sorts of peculiar directions, and that creates further issues. But at the same time, if we have abnormal structure, we have an increased requirement of those muscles to work harder to try and stabilize and protect something that actually is doing more damage in doing that. So it can be a little bit more complex, but we do vibration work to just help those muscles manage a little bit more effectively, so they're working more effectively without stretching them excessively in any particular direction. The final one that is sometimes relevant, often not initially but later on, is to just get some of these thoracic joints moving a little bit more effectively. Because if they can move a little bit more effectively, then the neck has a little bit more of a breather. It doesn't have to do quite as much work. And often when we have those whiplash injuries, this locks up really stiff, and then the neck is left to move and dangle around all over the place, making itself worse. So doing some spinal adjustment is really, really important in these cases for the long term, just to get those joints moving effectively while the neck is recovering properly and going through the necessary rehabilitation and remodeling. You can learn much more about whiplash on our website, so do please check that out. And if you've got any questions about your whiplash and how we can help you at the clinic, then do use any of the contact modalities on our website to get in touch.